In this video, we'll talk about fetal heart tracings. Starting off with the basics, you need to understand what an acceleration is versus a deceleration. So on the picture on the left are decelerations, where there's dipping of the curve, and that's always bad. The picture on the right are accelerations. You can see the curves are always going up. Accelerations are what you want. Those are good. Now let's talk about specific types of decelerations. When you look at fetal heart tracings, if the tip of the fetal heart rate curve lines up perfectly with the tip of the contractions, you're having early decels, and this indicates fetal head compression. If the tip of the fetal heart tracing is just past the contraction tip, then this is considered a late decel, and this indicates uteroplacental insufficiency. So for some reason, the placenta is not getting enough oxygen to give to the baby. Variable deceleration, it'll just look variable. There's no particular pattern to it. Sometimes you can see sharp V's at the bottom of the fetal heart rate as well. This indicates placental compression. So in my mind, I just imagine the placenta being compressed in variable different areas. This fetal heart tracing shows a sinusoidal tracing, and this always indicates fetal anemia or fetal hypoxia. This is considered a category 3 heart tracing, which means you have to do immediate C-section. Fetal bradycardia is defined as less than 110 beats per minute, and this can occur if the mom is hypothermic, if she's taking beta blockers, if the fetus has hypothyroid, or if the fetus has heart block. Fetal tachycardia is defined by greater than 160 beats per minute, and this can occur if the mom has a fever or if they're taking beta agonists, maybe the fetus has hyperthyroid. Lastly, let's talk about variability. The picture on the left is bad because there's no variability. The fetal heart tracing looks the same throughout. The picture on the right is actually good. You want variability in the fetal heart tracing. So when you have a category 3 tracing, that means there's no variability, there's decels, there might be bradycardia. It's all bad things and you need to intervene. That usually means delivery. A category 1 tracing would mean that the heart rate's in a good range, 110 to 160. There's a good amount of variability, there's no decels, and there actually might be accelerations, which are good.